Our first guest today is Dr. Lydia Laboccetta, a urologist with Novant Health Urology Partners. Welcome to the show today, Dr. Laboccetta.
Thank you for having me.
Well, it's a pleasure to have you back. I know you've been on the show before, but you've brought some interesting information for me today and something new called Greenlight laser therapy. So we're going to talk about this a little bit.
Yeah. Greenlight photovaporization of the prostate is basically a new surgical instrument for doing a surgery that we urologists have been doing for ages and ages. BPH is a kind of buzzword for prostate hypertrophy or prostate urinary problems. And so a lot of guys have overgrowth of the prostate over time that makes it difficult to empty the bladder or that just causes some urinary symptoms. And years ago, when a patient walked into a urologist's office, if they were male and they had a urinary problem, they had surgery. And so since then, the pharmaceutical sales companies kind of caught up with things, and there are now a number of different drugs that are available for treatment. And I think, unfortunately, that some people have kind of forgotten about the surgical options. And this Greenlight photovaporization of the prostate has made the more traditional surgery a lot less, you hate to say less invasive because it is still surgery, but it's now an outpatient surgery that can be done with really minimal risk. Also, patients used to lose a lot more blood with the older surgeries, but our visualization is really good with this, and since it's a vaporizing technology and a laser technology, it actually causes coagulation as we're going, so there's a lot less bleeding, which means that you get to go home the same day.
Really? That's great.
Yeah, it is. I have this video here that I'll play for you, and I think it's kind of self-explanatory, but I'll kind of talk through it. This is a company called AMS, and they make a lot of urologic equipment.
No, is that the instrument?
This is the actual probe that we use, and this wire or the fiber goes in through a scope.
So can you pause that right there?
So this is actually the laser fiber that we're using, and the laser energy is deflected, so we have better control so that as we're operating, we can see what we're doing, we can see where the laser energy is directed, and we can see how the tissue is being treated.
Okay.
And so in the operating room, of course, we have the patient completely prepped out. This is the anatomic location of the bladder and the prostate, and we can do all of this surgery without any incisions. So we actually go in through the penis with a camera, and we put our laser fiber through the camera like so. And so this is that same probe that we saw in the earlier part of the video, going through the camera scope.
Okay.
And this is what I see. So from the inside, as I'm operating, I can see where the prostate tissue is, and I can see where the laser energy is being directed, which makes it a very safe procedure because I know that what I'm vaporizing is what I want to be vaporizing.
Looks like it's carving out a piece.
It's just like coring out an apple. It really is. And you know, of course, this is an animation, so you can't really appreciate it, but you really do have very good hemostasis during the procedure, which is blood coagulation. And so, you know, if you can kind of imagine the kind of before and after, on the left side of the screen, we have the normal prostate anatomy. This would be the bladder up here, full of urine, and prostate tissue pinching together on the urethra, right obstructing the flow of urine. And so with this procedure, basically we open up that area that you urinate through and create kind of a void. Men oftentimes say to me, well, what happens to it? And it really is vaporized. It disappears.
It's gone.
It's gone.
Okay, and is that the urine, can you show us here on that one? Can you point to how it's carved out?
So we have this carved out area of prostate tissue here. So rather than having a full apple, of prostate tissue, we're kind of left with a rind on the outside. And so, when you're thinking about considering, people always worry about nerve damage and blood vessel damage and all those sorts of things, which is reasonable. But all of the nerves and blood vessels that contribute to erectile function and other important things are well on the outside of this inner core of the prostate tissue.
And this might be off the topic, but with the enlarged prostate or this narrowing here, does that contribute to sexual dysfunction, or does it just impact urine?
It really just impacts urine. It does definitely affect ejaculation, which is one of the things that we talk about with the surgery. There are some men who have this surgery and they have recovery of their ejaculation because the ejaculatory ducts go through the prostate tissue. So when you have all of that obstructing tissue there, sometimes you can have it come back. Usually with this procedure, though, I tell guys that they probably won't have ejaculate come out because we're basically coagulating over the area that the ejaculatory ducts are. But in terms of orgasm and erectile function and all of that, that all remains the same.
Okay.
So continuing along, we have a beautifully emptying bladder on the right side. Which is also where I think it's important to understand the preoperative counseling and the preoperative workup that we do, because certainly it's possible to have more than one problem. Sometimes there's a problem actually with the bladder and not just with the prostate. Sometimes the prostate has over time caused damage to the bladder. And so one of the things that we do preoperatively is just try to understand people's voiding function so that we can help predict their post-operative outcomes.
Well, good. That's great information. Thank you so much for bringing us that today. Now, I know you have a new partner, and I'm curious, does he do this also?
He does a type of photovaporization that's based on a bipolar energy. And, I tell everybody this surgery is one of those things that has all sorts of different instruments that can be used to do it. So, and we both do the traditional transurethral resection where there is tissue left over for patients who are concerned about pathology and things like that.
Great.
So, and he has talked about doing the Greenlight too. So I'm trying to turn him onto it.
Well, good. Are you taking new patients at
Always.
Novant Health Urology Partners?
We always are.
And can you provide us with that phone number?
Absolutely. The number is 910-721-4150. And our scheduler, Lena, is amazing. And she's very helpful with patients.
Well, thank you so much, Dr. Lydia, for coming back on the show today. And
Absolutely.
I look forward to having you again soon.
Thanks for having me again.
You're welcome.